Hi, I'm David Jones. I'm director of Morrison Cancer Center. Today I'm fortunate enough to have Leslie Kathman, APRN, our coordinator of our survivorship program, joining us. And we have had a overwhelmingly positive response to our survivorship program. And Leslie's been gracious enough to attend today to tell us a little bit about the program. So Leslie, with the survivorship program, why don't you go over a little bit what a typical visit entails and the type of items that you cover with those patients?
Yeah, I would love to. Thank you. Typically, we have a one-on-one visit with the survivorship patient and myself, and we go over any current symptoms they may be having, as well as late symptoms that could occur because of the treatment or chemo that they had. And then we talk about any preventable things that they can do as well. And I do give them a spreadsheet that they can refer back to for any other preventative tasks that they may need to complete. We're also able to make very specific recommendations or referrals based off of any symptoms or side effects that they're having, be that therapy or additional imaging. Maybe they need some more nutrition assistance, maybe different medications, and we're able to identify those in those appointments as well.
Great, great. How long does a typical appointment take?
If it's their first appointment with us, usually about an hour. We do recommend annual follow-ups, and those usually take about a half hour to 45 minutes, depending on how the patient's doing.
Well, I do know that, as I mentioned previously, you've had a pretty overwhelmingly positive response to this. Can you tell us about how many patients you've seen in the last year and a half since you become coordinator of the program?
Yeah, so since we kind of revamped everything and went to really focusing on the one-on-one survivorship visits that the patient just comes for that reason, we've touched over 340 patients.
Great.
And those referral sources come from all over. They didn't have to receive their treatment at Mary Lanning. They could have got it in Lincoln, or it doesn't matter where they live either. They could live in Lincoln and come see us, so they can be from anywhere.
Oh, that's great, great. So how do they go about getting an appointment with your survivorship program?
Yeah, they can talk to their oncologist or radiation oncologist, or they can self-refer, and they can just call either the Morrison Cancer Center in Hastings or Grand Island.
Great, thank you. I really appreciate your time with us today. And
gotcha.
If you have any further follow-up questions, you'd like to find out more, feel free to reach out to Morrison Cancer Center and ask for Leslie Kathman. Thank you.